very, very happy.
This is the Nwe Mulago Specialized Women and Neonatal Hospital. It is only 3 days old since its opening and has already received at least 72 patients.
The patients we are seeking antenatal services, reproductive medical services, in vitro fertilization, or assisted reproductive technology.
This specialized hospital will attend to special cases under classified standards for which Cabinet approved the charges in sync with international standards.
As an example, patients will pay a consultation fee of 50,000 Uganda shillings. Admitted patients will pay 80,000 shillings per day, and this includes food, linen, and utilities. Under reproductive medicine, patients seeking in vitro fertilization will be required to pay 13 million Uganda shillings, a fee that is below what is currently charged by private health facilities.
On top of the charges, those who cannot afford the tariffs will be catered for.
Is currently being worked upon and will be put in place as soon as the gift period is over. There is a committee that is set up to assess the eligibility of patients seeking a waiver. The committee will comprise of head of clinical services at the hospital, who is the deputy director, the nurse in charge of that particular unit, a medical social worker, and the head of administration. And this committee will set guidelines on the eligibility criteria for the waiver. For staff working at this facility who require specialized services, we shall give them a waiver because they will be offering services at the same time.
To access services at the hospital, every Ugandan shall be required to produce a national ID and a referral letter.
So patients accessing services who come with their letters will be attended to immediately. However, there are also services that are exclusively offered at this neonatal and women's hospital, such as in vitro fertilization and laparoscopic surgery. Those ones may not necessarily require a referral letter.
Addressing journalists in Kampala, Minister for Health, Jane Ruth Acheng, says refugees and international patients have their own arrangement.
I am very much aware that we have foreigners who come in and access treatment in our private facilities. In Nakasero, in IHK, they do pay for services. So foreigners will be expected to pay. The 25% addition that they are paying on top of our costs is extremely minimal. And as I mentioned before, there will be a gradual process of increasing depending on the income, the numbers that are coming to access services.
Currently, the hospital is giving out free health services to Ugandans till 9th October, when Uganda will celebrate its independence. Ivan Kahwa, UBC News.